Okay. Hello, everyone. Good afternoon. Can everyone hear me? Can you type yes into the chat room, please? Today is September 22nd, 2021. We're still sort of semi-lockdown with COVID, so we're still doing webinars. And this year, Dr. Jimmy Chang has decided to come out to do more lectures, and I have the privilege to be the MC and co-speaker with him to ask questions. And today's topic is on case studies focusing on infertility, male and female infertility. Dr. Chang will teach us how to read the body temperature, what are also his tried and true formulas he will discuss today, and also how long should the treatment periods be, how often should you ask the patients to come back. Okay, so before we get started, will you take a look at your chat room, your Zoom meeting? Take a look on the bottom. I think you will be able to see the option of chat. If you click on the chat, please open that. And on the bottom of the chat, it says to who? Okay, so that part, would you change it to everyone instead of just to panelist or host? Because if you do that, have the default setting, only we will see it. We want everyone to see your questions, or if you want to share anything in the chat room for everyone to see it. So please turn that to everyone. And then secondly is in the middle of the screen, if you go to the middle of the screen, you will see a divider. Do you see a divider between the PowerPoint and also my face, the video on the right? So the middle, there's a line. And if you put your mouse to the line, you can drag the line over to the left or right to enlarge the video or to enlarge the PowerPoint. Can you try that as well? So in case you cannot see the PowerPoint very well when Dr. Chang is talking about certain ear, findings or pulse, you can always make your PowerPoint bigger so you can see better. All right. So today's webinar is from 2:30 to 4:30 with 1 hour in the middle. We will take a break, 2 hours today. There's no CEUs today because he wanted to share a lot of information. So we decided this maybe a month or two ago, and that is not enough time for the boards to approve the courses. So today there's no CEU, but we are going to be applying for, Donna is going to be applying for CEUs for the next round of Dr. Chang's classes coming up next year, January, February, and March. So we have designed his classes for each month to host 2 classes, one in Chinese, one in English. Okay, so Donna, when it's ready, she will post the class topics. Pretty much is going to be similar to this, where he will discuss case studies and go over how he prescribes the herbs according to what the pulses and the ears and the palms look like. Okay, so very practical clinical lectures. Okay, and then after that, I think that's about all. If you have any questions, can you guys type it into the Q&A? If you mouse over towards the bottom next to the chat box, you have the Q&A box. If you can put your questions there, then after each case, when he talks about the case study, we can ask him specific questions about the patient or about the herbs. So we will go and look in there for the questions. Okay, so if it's all good, let's go ahead and start class and welcome Dr. Jimmy Chang. So Dr. Chang, can you take over and share your PowerPoint, please? Share screen.
Okay, can you hear me now?
Yes.
Sorry. Hi guys, this is Jimmy Chan. This is me again. Today we're gonna talk about some very interesting topic, virtual internship infertility. I hope everybody will enjoy it and you will find it very useful.
Is that normal? I don't see him. I don't see him.
What? Can you hear me?
We hear you.
Okay. So everybody's here, huh? Now let's begin with the seminar here. Okay, let's take a look at this. This is a very important chart for you to verify your your patient's condition, you must learn how to use it. The basal body thermometer, you can have this to make a empty copy in your office to show it to your patient. If they want to get pregnant, they have to do it with this basal thermometer. And please make sure they put it under their tongue every morning before she gets up and measure all the temperature. This is supposed to be the period time. Let's make it 5 days. And the temperature will always low after the period, before the ovulation section. So hopefully it will drop and go up like this. That will make it a perfect chart, means the perfect condition. And make sure they do all the intercourses around those days, like 2 or 3 days consecutively. And please do not do anything before that. Make sure the husband has enough bullets, okay? And afterwards, the temperature should be high, actually, we're over 98 will be better. This is a typical pattern. And generally, it looks like this. This is the period time and temperature. The follicle phase will be low, and this is the ovulation. Actually, not only 1 day, should be 2 or 3 days consecutively. And maybe you want to ask your patient to buy himself a ovulation test kit and to try to find the best time to do it. And afterwards should be like this. So if you want, I always use my herbs. My strategy is that, you know, people, ladies, they always have some dead blood or blood stagnation in the uterus or outside the uterus, around the ovary area or in the whole abdominal pelvic. So in this section, I always try to use some kind of blood movers, like a cyst breaker or a resolve lower, to destroy all the dead blood that exists in her body for quite a long time. And after this, you have to be careful. Maybe she got pregnant during those days. So in this luteal phase, I always use something to tonify the kidney yin, which means I'm gonna tonify the ability of staying pregnant, just in case, okay? So you must have your patient do it. Tell them don't be too lazy, huh? Okay, this is the pulse size for hormonal differentiation. This is the sorry, this is Chinese. Anyway, this is the normal 寸关尺, normal pulse positions 寸关尺, and this is the so-called heart 7 pulse. I forgot. I should have used English version. But anyway, the blue lines, the tendons, and this is the heart 7 pulse. For a man, the right hand heart 7 pulse should be strong. If it's not, that means his kidney yin, the sexual ability hormone, may be low. For ladies, the right hand side, the heart 7 pulse should be weak. If it's too strong, that means the lady is very bossy and hormones out of balance. Maybe it's due to the polycystic condition. So for a lady on the left hand side, this heart 7 pulse should be strong, and that will be a good condition. You can find out their pulse will be strong when they're pregnant. Okay. So try to take this pulse. This very, very small section is smaller than the normal 寸关尺. So try to feel this area and to verify their hormonal condition. So if a lady that both hands the heart 7 pulse are weak, that means she's in a low hormonal condition, means she might be aging too fast. Then when we do the treatment, we have to do it accordingly. Maybe we use more tonifying herbs. You will see later, okay? Okay. See, now we can do some differentiation diagnosis. See this area. So this area for lady is This area is the ovulation, and this is the ovary area. This is ovary. You see, there's a dark spot in there. That means there's some dead blood in there, and it's above the ovary area, so it's in maybe in the pelvic. Why there's a dead blood in there? Could be for previous miscarriage, operation, or endometriosis, whatever. But whenever there's a dark line, the dark spot there, we must start our treatment by using some blood movers. Okay, you can see this one. We call a hernia, the big one here, but it doesn't have a brown spot on it. So we just simply we use this, almost the same thing to destroy all the blockage in there. Okay. See this one? Oops, sorry, I jumped. Okay, same thing here. See, there's a little bump, but this area seems to be a little red, so there could be some inflammation on her ovary area. So we must use something to treat it. And for this is a man. So look at that. This is abdominal area. It's all brown color, so it means dead blood. The other place, this guy has a lot of dead blood on his body. This is the lumbar and all the old injuries on the hip. And this sharp, pointy area means OCD. We don't mind it. Let's focus on this abdominal testicle area. This is the testicle. See all the dark spots? There may be some blood stagnation due to the varicose seal or previous injury or anything to happen. All the dead blood will cause high temperature that will kill the sperm. It's very bad for infertility. Okay. Okay, this again. See? Abdominal hernia. And this is the neck and shoulder, don't mind it. And see this one? This is a man too. See the redness and darkness here? The darkness here means dead blood. See the redness, I will always tell them they have some kind of inflammation on the testicle. Inflammation will cause high temperature. High temperature will kill the sperm. So that's very bad for wanting a baby. This is the lady. See, the ovary area is dark. You don't have to take the pulse. And just by watching this, you can see the dead blood there. Dead blood will cause blockage. So the sperm might not easily penetrate through the cervix to get pregnant. So we must destroy it first. Do not use this kidney young hormonal tonification in the beginning. We must destroy the blockage before we tonify them. Okay, this is the same thing. See the darkness here? A little bit, not too bad. So don't worry. Oh, again. See? This is the testicle. So the darkness there, that means blockage again for another person. So again, we should use something like a resolve lower or my system breaker to kill that before we make him stronger. And this one, why do I put it here? Nothing on it, right? But it's too small, this area. Small means the hormonal production isn't enough. I've seen a guy with a problem in Taiwan, a young guy, 30 years old. He doesn't have any sperm count, 0. Why? His testicle area is fairly flat and small. It's gone. When I look at that area, I know it's totally hopeless. It's constitutional. He was born that way. I don't know. It's not treatable. But so look at here. You can tell how big his testicles are, or how good her ovaries are. If this is very small and very flat, then you know that might be a difficult. The sperm count could be very, very low. Okay, any questions? Okay. Same thing. Same thing here. This is the stomach. It doesn't matter, but the stomach looks so dark. That means maybe some ulcer in his stomach. But this, this ovary area, see, also some darkness here. That means dead blood. We must destroy that. And you will see if you have some patients like amigo people, their ovary and testicle area usually very big and strong. And I always ask them, how many kids do you have? I have 8. I have 5. Some even have 10. Oh, they're good. And this area is also darkness. See the darkness here? So when you see this, you must use something blood movers like my cyst breaker and so resolve lower or anything lump special. See, this is the lump. Usually they do not feel any pain or any discomfort, but it is there, causing so much trouble, causing blockage, causing high temperature, causing the sperm count be low. So watch. This is the testicle, and this is the something above, some area above the testicle. Okay, any questions so far? No question? Okay. Okay. Let's go to test case 1. This is the fast reaction. Few times the treatment, they got pregnant. Okay. This is the lady, 39 years old, not very young. So let's take a look at the pulse. Okay. Okay. This is the stomach. Whenever you have stomach fire, that means maybe a sugar problem. Sugar might be a problem for infertility too. So I always advise them do not eat too much sweet things. Sugar is no good for that. And this is the neck and shoulders on the right hand side. But about the heart 7 pulse we mentioned earlier, remember? I always draw it here. I use the red line to draw it, means there is some jump in there. So for a lady, this is the male hormone, which is not too good. And for the left-hand side, the pulse on the left-hand side, the chi area is thick and forceful. That means fibroid. I see something blocking it. And I checked her left heart 7 pulse. I use this green lines or blue lines means negative, which means her hormonal production is low. So we must deal with it later. So this is what we're gonna do in the beginning stage. This is her first visit, okay? This left one, but the left one is very weak. That's the immune system deficiency. And with maybe a little depression, a little anxiety, but whatever, I give her this See, I give her baby treatment, abdominal and energy. Cyst breaker, 益母草、少妇足浴汤 and 八色散。Because, okay, my cyst breaker is a combination of 16味流气饮、三种溃坚汤 and 折冲饮。I put these three together to destroy all the blockage in the human body, not only the ovary area, but also for even the thyroid, hyperthyroidism with the grave disease, with the hyper swollen. And the cyst breaker is very useful. We call it resolve lower. I used first in the beginning to treat ladies with menstrual pain. It's very effective. 16味流气饮，流气 means this is push the qi. 三种溃坚汤 san means destroy the swollen tissues. This only is for blood moving and for pain. So I use 40 this. 益母草 is a good, 益 means good, 母 means mother. 益母草 is some kind of a water repellent, especially to clean up all the dead blood, the residues in the inside the uterus. So I use 益母草, especially for chappy ladies and with the water retention. See, I notice the water retention here because her body is deep, the pulse is deep and forceful. You can see the water retention. And 八正散. Oh, I hear one more. So also, 益母草 is good for kidney function to get make the human body to expel the water more easily. And 少妇足浴汤, 少妇 means abdominal area, 足 means expel, 浴 means dead blood. So again, I use this very frequently to get rid of all the dead blood in the abdominal area. How do you know there's a dead blood there? Of course there are. The lady been 39 years and she has some the doctor told her that she has very thick lining in the uterus, so they scrape them out. So after all those procedures, some including some lady with the miscarriage and or something like that, they definitely will have a lot of dead blood existing in the abdomen area. So if you don't clean it inside the uterus or outside the uterus, there's no way they can get pregnant. Not even with the artificial process. Even they have the eggs or the sperm injected into her uterus, it won't work because of the dead blood. We have a lot of interesting cases and cases reports from Taiwan. And why do I use Parkinson? Because I see some blood. It's not the blood stagnation, it's the inflammation down there. Oh, here. See also on the ear point, I see there's a little bulb on the ovary area. So I know some inflammation there. And I use Parkinson. It's like you may call it water pills. Water pills means to help to get rid of the water inside the uterus and also to clean up the cervix, because sometimes this pulse means the fluid in the cervix may be too thick, and it might cause some allergy reaction or some kind of a resistant power against the sperm from going in. So I use the Parkinson to clean her vagina area, her cervix, and even the uterus and everything. This is very important, huh? Parkinson. Easy. You can use it for any chappy lady with a little bit swollen condition, huh? I'm sorry, it disappeared. Somebody asked me if the ovary area is small and flat, what are you gonna do? We'll be talking about that later. I don't think acupuncture can do that. I need with something to tonify, something to put into her body to make her, in other words, make her stronger with the hormone production.